Let's bring him in. Our good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Little sports medicine for us. Dr. Joe, what do you have for us?
Hey, Ray, how are you doing today?
I'm doing outstanding, my friend.
Great. Yeah, a lot of what I look at these days is observational with a career's worth of sports medicine, particularly pediatric sports medicine. And just a couple of points I want to make today. We still see a lot of knee and shoulder and hand and wrist injuries, but one thing that's really increased in the last decade, Ray, is hip and groin injuries. And there's a big point I want to teach about hip and groin injuries today is I think part of why it's increasing, there's so much more involvement in sports with pivoting and cutting, and so soccer, basketball, football. On the girls' side, gymnastics and ballet with a lot of twisting around the hip and a lot more hip and groin injuries. And I just want it to be very clear today, by the time I'm done, that with young athletes, there's a major difference in the type of injury and in how to evaluate and treat those injuries. We can really head down the wrong path in treatment of hip and groin injuries if we treat people like adult and fully grown athletes. So the ages we're talking about, Ray, 10 to 16-year-olds have totally different kind of injury. And I want to point to a few of the differences. Those that are 15 and older, you notice those two ages overlap because there are some very mature 15, 16, 17-year-olds. They're done growing, and they are getting to the point where they get the adult injuries more. But there's the most dramatic injury that I see in young athletes and have seen a career's worth is an injury where everybody comes in to see me and they have a bad injury. They come limping in. They've been told they have a groin tear or a hamstring tear or a labral injury. They come in on crutches or a wheelchair. They move quickly and twist quickly, and they feel a pop in the hip. Number one. Number two, they feel a really localized pain. It's in one specific spot. That's never the picture with a muscle injury. And in fact, they almost never in that age range that I talked about, the younger 10 to 16, almost never tear the muscle around the hip and groin. And they very, very rarely tear the labrum. The labrum is the injury of the hip that's all the rage in the last 15 years. Younger kids just do not get that injury. They get an injury called an avulsion fracture of the growth plate. So here we are talking about growth plates again. We've talked about them a lot, but kids are still growing about the pelvis all the way up to about age 14, 15, 16. They don't get height growth from this anymore. They get girth growth. So if you see kids that are 12 versus athletes that are 16, the big difference is they're bulkier in the shoulders and the hips. And as they grow in the hips, they have these growth plates that a muscle will pull with great force, and they will actually get a pull-off fracture called an avulsion fracture. Here's the really good news. They heal quickly. So they come in the office, they think we're miracle workers. It's kind of fun to treat because they come in on crutches in a wheelchair, and when they take a period of rest, most importantly for those who care a lot about their sports, start physical therapy and rehab, many and most are better in 4 to 6 weeks. Almost never do they need surgery, and they are easily diagnosed by the way they present in just a routine X-ray. A routine X-ray will show this small separation of the growth plate, and when treated, it wants to heal when treated appropriately. And so the big point here is you have to find a practitioner in sports medicine, whether it be PT, trainer, sports medicine doctor, orthopedist, who sees young athletes. Otherwise, what happens, I've seen so many kids through the years who have headed down the road of unnecessary and expensive tests, long period of time out of sports, and they don't need to be. 4 to 6 weeks, and these kids will get better with this avulsion injury. But the point of the matter is we need to understand the maturation of young athletes, and it's totally different injuries that young kids get than their adult counterparts. So that's a really important point that I want to make, is make sure you get to a place. In our region now, we have so many different places that have pediatric sports practitioners, and they'll do a good job. They'll pick this up it's one of those that we can diagnose in our sleep almost. I've seen so many of these through the years, and in other places there's a lot of hand-wringing and other issues and expensive tests. So I really wanted to make that point about the difference in these hip and groin injuries in younger athletes.
I think that's terrific, Joe. Go to the area of expertise, and that's a great point that you mentioned. Adults and kids, same type of symptoms, but it could be, right, as Joe just mentioned, right, Joe, a completely different way of attacking that injury.
Completely different, and the good news is they heal very quickly. They have youth on their side, and they heal these growth plates quickly. They're almost shocked themselves in 4 weeks. They come back, knock on the door. I have them running, jumping, doing all kinds of sporting activities, and they're better already. So it is really important. And one more thing I wanted to mention, when you're thinking about the sports medicine team, I don't know that I've mentioned it enough. It's really important. People need to be aware of what the strength coaches do in the area of sports medicine. They're kind of an in-between group that's kind of part of the coaching staff and part of the medical team. And we started to know about 10 years ago in college and the pros when one of the highest paid assistant coaches on most coaching staffs at the highest levels would be strength coaches. And now most of our high schools have people with knowledge of strength coaching, and they are so important. They understand the difference of young athletes like this injury I just talked about. They understand the difference for different sports and for some of our female athlete sports, where they need to work on to get them better and quicker and stronger and ready for their sport. So look for the strength coaches in your high school setting. They're all over the place now, and they are a really important part of our high school sports medicine team.
Perfect. Joe, thank you so much for making time. You and that whole big clan of those congenies, you guys have a good Thanksgiving, okay?
We will, and thanks so much in the Akron area for all the generous use of your time, Ray. I give thanks for having somebody like you in our community. Thanks so much for all you do.
You're way too kind, but thank you, Joe. Much appreciated. Have a good one. We'll talk to you next week.
You too, Ray. Thanks.
All right. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.